Okay, so thanks for joining. I'm Dr. Mike Carver. You know who I am. I'm a chiropractor. Um, I talk all over the country about healthcare. There's a change happening in healthcare right now. I've seen it. A couple things are causing that. I think people got a big wake-up call that health is not being taken care of by the existing healthcare system. Um, you just look at some of the numbers, like autism. 50 years ago, it was 1 in 2,500 people. Today, it's 1 in 40 people. That's a pretty dramatic change. You look at their cancer rates. 50 years ago, it used to be 1 in 40 people. Now it's 1 in 2 get cancer. That's a pretty dramatic change. Only 29% of our youth are going to qualify for the military, mostly because of health reasons. What's happening to us? Our country's like not doing well. Our health is really bad. I've been in practice since 1991, and I notice there's a distinct difference in the health of younger people, like people in their 20s and 30s. They were pretty much healthy when I started practice. Now we're seeing them with a lot of health problems. Chronic disease in 1970 was 5 to 8% of the population. Chronic disease now is over 65% of the population. So there's some major things happening, and somebody's got to step up to the plate. Chiropractic is the largest alternative healthcare program there is, period. We need to step up. As chiropractors, we need to step up and lead our public to health. I mean, what we do, we've been attacked. We've been attacked by, being, first they tried to say we're dangerous, and that didn't work, because studies prove that chiropractors are one of the safest treatments you can get. That's why our malpractice is so low. You want to know who's dangerous in healthcare, just look at malpractice rates. Malpractice rates are based on the rate of injury. Chiropractors are one of the lowest, if not the lowest, in healthcare. So then when the attack on our reputation was, well, they over-treat. And some of us do fall guilty in that, but that statement is being based upon presence or absence of symptoms. And symptoms are the worst way to judge your health. Everybody watching this could agree it is possible to have cancer that's going to take your life and not have a symptom. That is possible. Like, for example, pancreatic cancer. The reason it's so dangerous is the symptoms show up at the very end of the disease. So judging by symptoms is not a valid way to judge your health. So chiropractors need to start standing up, being strong, and telling people what we do and how we do it, because we have a tremendously successful track record. Just look at something like a herniated disc, which is really not the thing we shine in the most. What we shine in the most is making people healthy. But if you look at chiropractic, the way we handle a herniated disc, I mean, we have a 90% success rate. We get paid peanuts for it. And you compare that to the surgery, which has a 75% failure rate. That's how many are being repeated in less than 2 years. And it's extremely expensive. We win all day long. We need to start making people aware of that. So our mission at AMI is to help chiropractors to be more successful. Yes, we teach integration, but we also teach chiropractic practice how to be more successful. I had very successful chiropractic practices. I had a practice doing 750 visits a week, collecting a couple $1 million a year back in the early 1990s. So we teach people, not to make them that big, but if they wanted to, they could. But we teach them how they can make their practice more profitable. And it's not just to make the doctors rich. Yes, the doctors do need to be getting rich so they can thrive and deliver more. But it's to get more people access to chiropractic, whether it's covered by insurance or not, because insurance is just going to whittle us down to nothing, hoping that we just dry up and go away. Why would insurance do that? Well, the Affordable Care Act said the cost of insurance policies is based upon the cost of health care. The more expensive health care is, the more they can charge for the policy. So they don't want people to get fixed. Most people that are in pharma-based medicine, I mean, the people want to get people well, but the system doesn't get people well. That's evidenced by our stats. I mean, you look at some of these stats and you go, how did that ever happen? What we're doing is tuning the body to the nervous system. Every weight-bearing joint in your body programs the brain. And when they're not working right, and 90% of the weight-bearing joints are in your spine, when they're not working right, when they're subluxated or they're stuck, there's less information going to the brain. When we open those pathways up, the body works better. We know that to be a fact. Studies have proven that over and over and over. So what we're trying to do is help chiropractors be more successful. So coming next Monday, October 7th, we are releasing something very, very, very special for chiropractors to help them go to the next level in their career. We've piloted and seen tremendous success and cannot keep this to ourselves any longer. What we're doing for practices is helping them to double their income and doing it relatively quickly. And then a lot of times doing it again and again. We would love to do that for you. So I'm just going to ask my team here, am I going to give them anything more than I gave them as far as information?
No, that's we got to keep basically tight lip until Monday,
So
next Monday.
Next Monday, October 7th, we're going to be releasing a big announcement. If you want to, how can they get in touch with AMI if they want to hear more?
Okay, so they can call us at our number, just the 888 777-0815 and
888-777-7015.
0815
0815.
and then discover at AMI.
So I can say it.
You got that.
Because these people are going to be saying, what's that guy saying? How do I get a hold of him? So here's the number. Ready? 888. You remember that? 888-777-0815. 888-777-0815. If you want more information, call AMI. Tell them you saw this live Facebook podcast or whatever we call this live Facebook Live.
Yeah.
And that you want to be put on the list to be kept informed of what's coming, because what's coming you're going to want to be part of. It's going to take your career to the next level and your lifestyle to the next level, and it should, because you deserve it, and we want to help you do it. I am going to try personally to make sure that chiropractic survives into the millennium, because we should. We're the best treatment out there, and people need to know more about us. We're going to help you be able to do that. So that's all I got. Thanks for looking in, and I'll talk to you soon.